All right. Thank you for joining us today for our educational lecture series on cannabis. Each session is designed to deliver a small dose of cannabis education. My name is Candace Hawes, and I wanted to thank all of our customers from Bud and Bloom, from the Pottery, from the Pharmacy Berkeley, and Santa Barbara for joining us. Our speaker today is Dr. Tim Shu, who is the creator and CEO of Vet CBD. What makes Vet CBD different is that it's veterinary founded and formulated, and that the company provides free support by phone or email to all their customers. And since Vet CBD is cannabis based, their products are regulated by the Bureau of Cannabis Control. This means that all their products are guaranteed and tested to ensure that they're free of any pesticides, any heavy metals, any microbials, anything that could make our pets sick. What I also found interesting when I was doing my research today, that is until 2019, veterinarians were not actually legally able to even discuss cannabis as a treatment for pets. So it's nice that that law has been changed and that our veterinarians can now make that, can now discuss that with us. Dr. Tim Shu is a veterinarian and has practiced clinically for over 10 years. He founded Vet CBD in 2015 with the goal of helping pets live their best lives with the use of medical cannabis. I know I have a lot of questions, so I'd like to welcome Dr. Tim Shu and give him the floor and to discuss using cannabis for pets. Thank you, Dr. Shu.
Thank you, Candace. All right. So I'm super excited to be able to share this with you guys. So we'll go ahead and get right into things. And then at the end, we'll have a Q&A session. So if you guys have any questions, feel free to put them in the chat afterwards and we'll get to as many as we can. Okay. Oops, it's a little bit out of order. All right, starting off with some technical difficulties, but we'll get through that. Okay, so I'd like to start off with an introduction to what cannabis is. A lot of people are unfamiliar with cannabis, rightly so. It was just recently legalized. So, a lot of people, they think, well, what is cannabis? We see pictures of the leaves all the time. Do you smoke the leaf? Cannabis, first and foremost, is a plant. It's an amazing plant because it's a pharmacological treasure trove. And the reason why we say that is because there's over 500 different components to it that may have pharmacological activity. And so what that means is that it interacts with their body in some form or fashion. Now, the cannabinoids, what we know as things like THC, CBD, are the primary molecules that are responsible for the medicinal and psychoactive effects that we see. But there is a lot of research going on looking at other components of the plant as well. So things like terpenes and flavonoids to find out what benefits those components have. Okay, in this next slide, what we've got three pictures here. And the reason why I like to show this slide is because a lot of people are unfamiliar of, where does the CBD come from? Where in the plant does the THC actually come from? And from left to right, basically what we're seeing the dried, cured, trimmed flower on the left. And then as we move right, we're starting to zoom in more. And so what we see is these little glandular structures that are covering this flower. And those glandular structures are called trichomes. Now, these are the glands that actually produce the cannabinoids and the terpenes that are in the plant. So when we extract from the plant and we're pulling the cannabinoids actually come from these little glands. And one of the reasons why that's important to know is because there is also something called hemp seed oil. And hemp seed oil is actually the oil that you get from pressing the hemp seeds. And so it's important because we have to realize that hemp seed oil doesn't actually contain any cannabinoids. Now, it is a very nutritious and healthy oil that you can find in the grocery store, but hemp seed oil is something that doesn't contain any cannabinoids. So when you're looking at products for cannabinoid content like CBD, it's really important to be able to distinguish between cannabis or hemp extract versus hemp seed oil. So when we're talking about cannabinoids, it's really important to understand that cannabinoids come in primarily three different forms or three different categories. And the first category is what we call endocannabinoids. And these are the cannabinoids that our own bodies produce. So a lot of people aren't aware about this, but our own bodies produce cannabinoids. And it goes for animals as well. In fact, it's present throughout the animal kingdom. So whether, cats, dogs, horses, ferrets, pigs, their bodies all produce endocannabinoids, and our bodies produce endocannabinoids as well. We actually need these cannabinoids to be able to function normally. So that's one type of cannabinoid that's out there. Now, the second category of cannabinoids is what most people are familiar with, and these are what's called phytocannabinoids. Now, these are things like CBD and THC, but it also has a lot of other cannabinoids like CBC, CBG, and CBN. Currently, we know of at least 120 different cannabinoids that come from the cannabis plant, but the most well-known and well-studied are going to be THC and CBD. There are other ones out there that are really popular that are available now and in a lot of full-spectrum products that are like CBC, CBG, and CBN, but we don't have as much research as we do with CBD and THC. So this is an area that has a lot of room for exploration, and we're really just at the tip of the iceberg when it comes to understanding phytocannabinoids and their therapeutic potential. Now, the third category of cannabinoids is what we call synthetic cannabinoids. And these are cannabinoids that are made in a lab, and these are designed to interact with the endocannabinoid system. And some of these are actually available for prescription through your physician. So let's talk a little bit about the endocannabinoid system, what it is and why it's so important. Well, first and foremost, the endocannabinoid system is a very recent discovery. So for example, you can think of other body systems like say, the digestive tract or the cardiovascular system or the nervous system. And these are body systems that we've known for a very, very long time and we have a pretty good understanding of. Now, the endocannabinoid system is an entire body system that was only discovered in the early 90s, and we're still just learning more and more about it. We know that this system consists of three primary components: the cannabinoid receptors that the cannabinoids interact with, the endocannabinoids that are the cannabinoids that our own bodies produce, and then the enzymes that make and break down these endocannabinoids. So, what's the role of the endocannabinoid system? We know, for example, like the cardiovascular system, its role is to get blood throughout the rest of the body. Now, the endocannabinoid system is really interesting because the role is homeostasis of bodily functions. And so what that means is it's responsible for balance, from preventing there from being too little or too much of something. And it has a function in a number of different things. So, these are just some of the things that we know the endocannabinoid system is involved in. For example, it helps to regulate appetite, metabolism, sleep, pain, mood, memory, movement, inflammation, and even reproduction. What's really interesting is that the endocannabinoid system, scientists originally thought it was only limited to certain parts of the body, but nowadays, everywhere that they're looking, they're finding parts of the endocannabinoid system exist, whether it's the GI tract, whether it's the urinary system, bone, musculoskeletal system, skin. We're finding that the endocannabinoid system is all throughout the body. And what's really cool is that this endocannabinoid system isn't just present in humans. It's actually present all throughout the animal kingdom. So whether it's mammals, fish, reptiles, amphibians, birds, they all have endocannabinoid systems. Even a really, really tiny water creature called the hydra actually has an endocannabinoid system too. Fun fact, the hydra is actually known, it's actually famous because it doesn't age, it doesn't die of old age. So that's just a random fact about the hydra, really cool little water creature. But the hydra also has an endocannabinoid system as well. So let's talk a little bit about some of the cannabinoids. We've all heard about CBD. It's made huge headlines in the news over the past couple of years. And some of the reasons why it has made headlines is because it's non-intoxicating, meaning that it doesn't cause a high. It does have an excellent safety profile, and it can benefit multiple species. So, a lot of the news coverage has been about how CBD can benefit humans, whether it's for anxiety, pain, or seizures, but it does also benefit other species as well. So for us, we've seen it benefit dogs, cats, horses, birds, ferrets, pigs, guinea pigs, rabbits, and rats. So there's been a wide range of species that we've been able to work with that have received benefits from CBD. So what are some of the therapeutic benefits of CBD? We've all heard a lot about, it does this, it does that, it does a whole bunch of things. What we do know is that it is very good at a number of things. Not everything. That's something that's really important to realize is it doesn't work for everything out there. Some of the things that it's very good at doing is it's great at relieving pain. It's very good at relieving anxiety. It can help with seizure control. What we've seen is that it can not only decrease the number of seizures a patient's having, but if they do have a breakthrough seizure, it can also decrease the intensity of those breakthrough seizures. It's also good for nausea relief. It's also a neuroprotectant. It has anti-inflammatory properties, and it has potential for cancer. Now, a lot of people have heard about, anecdotally about using cannabis for cancer. And the reason why I put a question mark next to cancer is because we don't really know the extent of the benefit of cannabinoids for cancer. And I'll get into that a little bit later on. Now, I want to take a moment to talk about THC. A lot of people know about THC. They know that it's the cannabinoid that's responsible for causing a high in people. Now, this high, or what we call an intoxication, is actually dose dependent, meaning that very, very small amounts of THC aren't going to cause a high. It's at higher amounts that actually cause a high. And this is because of the activation of the CB1 receptors that are found in the brain. And so the intoxicating effects or the high effects are going to be the limiting factors for therapeutic uses. Now, that's not to say that THC can't be used, because THC absolutely has medical benefits, and we do use it in our animal patients as well, but we use it very carefully. So what are some of the therapeutic properties of THC? Well, we know that it can be used for pain relief, appetite stimulation, nausea relief. It has anti-inflammatory properties, it has neuroprotectant properties, and potentially it may have anti-cancer properties as well. So a lot of times, people will ask me, what can cannabis be used for? And so a couple of years ago, I came up with an acronym to help people remember easily what cannabis can be used for. And that acronym is PAINS. So that's spelled PAINS. And what that stands for is it stands for pain, anxiety, inflammation, nausea, and seizures. Now, that's not to say that those are the only things that cannabis can be used for. There are other things that cannabis can be used for as well, but those are the things that it's most commonly used for, and it's a quick way to help people understand and remember what we use cannabis for. So when we use it for pain control in our patients, in animal patients and human patients, one of the big things that we use it for is chronic pain, which comes from things like arthritis. This is something that affects a lot of our older population of dogs and cats, but we've also had other species that have arthritis too. So for example, we've had people use it for their birds that have arthritis, for their horses. So it's not just limited to humans or dogs and cats. Any animal can get arthritis, and we have found it to be beneficial for that. It can also be used for neuropathic pain. So what that means is that pain that generates from damaged nerves. A lot of times we'll see this in our IVDD patients, and what that stands for is intervertebral disc disease. And so we tend to see this in dachshunds, sometimes corgis, or bulldogs that either have elongated backs or shortened and scrunched backs. What happens is they get a disc that slips and essentially presses up against their spinal cord, and it can cause them a lot of pain. It can cause them a lot of neurological deficits. And we've seen some good results for that in terms of increasing their pain and then also decreasing the neuroinflammation that's going on in those patients. So one of the other big things that we use cannabis for in our animal patients is anxiety and stress relief. The two biggest categories that we commonly see animals being affected by when it comes to anxiety are separation and noise anxiety. Separation anxiety tends to happen when the owner leaves for work and they can't bring their animal with them, and the animal feels anxious because their owner's not around. We've seen this to be very beneficial in mostly dogs. Sometimes cats will get it too. There are some cats that are very attached to their owners, despite what most people might think about cats. But we have seen it relieve that anxiety in a lot of these patients. Now, in terms of noise anxiety, this is a big one every year when it comes to 4th of July and sometimes New Year's Eve also, is dogs, they can hear a higher range of noises than we're able to. And so a lot of times when they're hearing these noises, we may not be able to hear them, whether it's, from construction or environmental causes, but a lot of times it's from fireworks, especially around this time of year. And what we've seen over the past 5 years is we've seen a number of patients be able to benefit from the decreased anxiety and the anti-anxiety properties of cannabinoids. And for a lot of these patients, it's actually been a real improvement in quality of life. Interestingly enough, July 5th is actually the busiest time of year for animal shelters because of all the pets that are running away from the fireworks noise the night before on July 4th. Another reason why we use cannabis is for inflammation. So anytime that there's excessive inflammation in the body, cannabinoids like THC and CBD have anti-inflammatory properties. So they prevent there from being too excessive of an immune response, which causes the inflammation. And we commonly see this benefit patients that have allergies, especially with skin allergies. So when it comes to skin allergies, basically what happens is, the skin interacts with a little molecule that it thinks is some sort of invader when it's really not, something like pollen or dander, and it starts to attack it. And that causes a lot of inflammation and irritation. It causes the patient to be itchy. And what we've seen cannabis do is it decreases the excessive inflammation in these patients to help them control their allergies and to find relief so that they're not constantly scratching and itching on themselves. We've seen other benefits. We've seen some occasional patients present that have autoimmune disorders, and the owners have reported benefits in that. That remains to be seen on how effective cannabinoids are for that, just because there's not as much data as there is for other things like allergies. For IBD and IBS, that happens when there's excessive inflammation in the GI tract. We see that fairly commonly in dogs, and we have seen a lot of patients benefit from cannabinoid use because what happens is it decreases the amount of inflammation that's going on in the GI tract. So nausea is a really, really big one. Now, as any pet owner knows, if your dog or cat gets into the wrong thing, you may find a pile of vomit in your carpet, or it could be because of ongoing things like kidney failure. For example, in older cat populations, kidney failure is something that is really common. And what we see oftentimes is because they're in kidney failure, they are nauseous and they tend to throw up, and they also tend to lose their appetite. And so we have seen the nausea relief be very beneficial in a lot of these older cat populations that have kidney failure. Other populations that are affected by nausea, for example, cancer, chronic GI conditions, or car rides. So we have actually a lot of people that will use it for their dogs that get nauseous when they go on car rides. What they'll do is they'll administer 30 to 60 minutes before the car ride, and that helps to suppress the nausea so that they're not throwing up all over the car. Another reason that we use cannabis is for appetite stimulation. And interestingly enough, this is unique to THC. And with CBD, we don't really see appetite stimulation. We see good nausea control, but when it comes to appetite stimulation, it's really THC that's very effective. And so again, this can benefit patients that are suffering from kidney failure, cancer, or GI conditions. But again, as I mentioned before, whenever we're using THC, we have to be very, very careful with the amount that's being given. So that's why we have our ratios carefully formulated so that it's not excessive, so that it's appropriate for the patients to be able to give them that therapeutic benefit without causing a high in those patients. So anytime that THC is involved in the picture, you want to make sure that it's formulated by a professional that is familiar with animal physiology and the animal's endocannabinoid system. Another thing that's really cool about cannabinoids, and there's showing more and more evidence about, is the neuroprotective aspects of cannabinoids. So one of the interesting things is cognitive dysfunction. For example, in humans, it's really commonly seen through Alzheimer's disease. And dogs and cats can actually get something similar too. They can get cognitive dysfunction as they age. And we have seen a number of patients be able to improve on that cognitive dysfunction after starting cannabinoids. The same thing with neurodegeneration. There's interesting evidence out there that points to cannabinoids as being beneficial in neurodegeneration and stopping that neurodegeneration. We do need a little bit more evidence on that one, but it is promising and it is very, very interesting. In terms of CNS injury or brain injury, there is a lot of really promising studies out there that have looked at that. For example, they looked at stroke models in piglets and in rats, and what they found was that the patient populations that actually had CBD either on board before the injury or after the injury actually had better recoveries and actually had smaller infarct sizes when it came to the damage that the stroke did. Now, the last one that I want to cover on this slide is epilepsy or seizures. Epilepsy commonly is manifested, is a common manifestation of seizures are commonly associated with epilepsy. That's not the only time that you can have seizures. You can have seizures from a number of other things, but most commonly when we see seizures in our animal patients, it's usually with epilepsy. And what we've seen is that not only can cannabinoids help to decrease the number of seizures that these patients are having, but if they do have breakthrough seizures, we've seen also decrease the intensity of those seizures. And so this is actually life-changing for a lot of these patients. We've talked to a number of people that they were out of options. You know, their pet was already on anti-seizure drugs, but they were still having breakthrough seizures every single day. And the quality of life was so poor that they were actually considering euthanasia. As a last resort, they tried cannabis, and that literally saved the pet's life because it helped to control those seizures and it restored that pet's quality of life. Okay, so on this slide, I wanted to talk about cancer because a lot of people have questions about cannabis and cancer. Can it benefit cancer cases? There are a lot of preclinical studies, and these preclinical studies, what that means is they examine it in lab animal models. So, oftentimes, rats or mice, or sometimes what they'll do is they'll look at it in petri dishes or in test tubes. And in these models, cannabis, particular THC and CBD, have shown to have anti-tumor effects. And so what they've seen in these studies is that it could potentially inhibit the tumor cell growth. It can cause the tumor cells to die off. It can prevent the tumor cells from having access to blood flow. And it can also prevent these cancer cells from metastasizing or spreading to other parts of the body. So that's really promising, but these are preclinical studies. And without the clinical studies to back that up, we don't know how effective cannabinoids can be for cancer use. Now, interestingly, we've seen some anecdotal cases where patients that were diagnosed with cancer may have been expected to only live for a couple weeks, but were able to live for months out, or sometimes up to a year after they started cancer. And a lot of people have heard of human cases where cancer patients use cannabis to very, very good results. Now, the problem is that we don't have any sort of dosage guidelines. One of the issues is that there's not just one type of cancer. There's hundreds of different types of cancer. And each different type of cancer may respond to different therapies in a different manner. So that's why even when it comes to chemo protocols, you have a lot of different chemo protocols for the same type of cancer. And, the other thing is genetics. Each individual patient has their own genetics, and they may or may not respond to certain protocols. So while there is some promising studies out there for cancer in terms of how effective cancer can be treated with cannabinoids, we simply don't know that answer yet. But I'm very hopeful that with the change in legalization, we'll have a lot more studies funded that will be able to really look at the benefit of cannabinoids in cancer. So some of the veterinary clinical trials that have been done over the past couple of years, have shown improvement in a number of cases, primarily when it comes to arthritis in dogs and also seizure in dogs. So that was one of the big knocks on cannabis is that, we don't have enough clinical studies. And the reason why is because it's been very, very hard for universities to be able to study cannabis when it's considered something that's Schedule I. But fortunately, as the laws change, we are starting to see more and more clinical trials, especially when it comes to the hemp side of things, because there is greater access to it compared to cannabis. Now, this study right here was one done in Cornell a couple years ago. And what they did was they looked at CBD usage in dogs with arthritis. And what they found was that the dogs that were on CBD had decreased pain and they had increased activity levels. Another study that was done at Colorado State a few years ago looked at using CBD in seizure patients. And what they found was that the patients that were in the treatment group actually showed an 89% reduction in their seizures. Now, I love this slide because it really illustrates the difference between something that's full spectrum and isolate. Well, what do I mean by full spectrum and isolate? Full spectrum refers to extracts from the cannabis plant that contain a full bouquet of cannabinoids and other beneficial phytomolecules that are found in the plant. When we talk about what an isolate is an extract that is stripping away everything else and just leaving single cannabinoids. So for example, on the left-hand side, we have a lab test from a full spectrum extract that we had used. And this shows that there's multiple cannabinoids that are present. So you can see on the left-hand side, this extract had, THC, CBD, CBDV, CBG, THCV, and CBC. Now you can compare that to the picture on the right-hand side, and this shows a CBD isolate. And what that shows is that this contains 99+% CBD. So it really doesn't contain any other cannabinoids. And these are what's called isolates, or single form extracts. Why is this important? Well, it's important because of what we call the entourage effect. The entourage effect refers to the synergistic nature of full spectrum extracts and the fact that they provide increased benefits versus isolates. So, what is synergy is that when things are combined, they create a greater therapeutic benefit than if they were used alone. And so there's a lot of studies out there that actually back this up. We've heard a lot of anecdotal cases where people, will say that, they tried an isolate and then they tried something that was full spectrum and they found better results through the full spectrum product. Well, this is also backed up by studies too. So there was one study that came out a couple of years ago, and what they found was that when they used CBD isolate in these rats to measure inflammation and pain, the CBD isolate actually had a bell-shaped dose response curve. Well, what does that mean? That means the dose response was in the shape of a bell. So what that means is at a low level, they saw a little bit of a therapeutic benefit. At a mid-range, they actually saw optimal therapeutic benefit. Now, at a higher dose, they actually saw diminished benefit. So what that means was that with the isolate, they had to find the appropriate dose. Otherwise, they could potentially be getting diminished benefit. Now, they also tried whole plant extract that had multiple cannabinoids. And what they saw was a correlative dose response curve, meaning that at higher doses, they either saw the therapeutic effects plateau and even off, or they actually saw greater therapeutic effects at higher levels. So that's great, because then you don't have to worry about the potential of having too high a dose and then actually getting diminished benefits. Now, there was another study that was done, and they looked at tumors, and they looked at using either whole plant extract or full spectrum extract, and then comparing it to using pure THC. And what they did was they looked at these cancer cells in both cell cultures and rats. And what they found was that when they used the whole plant extract, they actually had greater anti-tumor effects compared to the pure THC that they used by itself. And then this study is actually very interesting, because what it did was it looked at all the observational clinical studies that have been done in humans that have refractory epilepsy. And so what that means is epilepsy that's really hard to treat. And what they looked at was they had they saw that there was some people that were using CBD rich extract that contained multiple cannabinoids, and then some people that were just using CBD isolates. And what they noticed was that the patients that were using CBD rich extract with multiple cannabinoids had a greater reduction in seizure frequency. They required lower doses to get those benefits, and they had fewer side effects compared to the groups that were using CBD isolate. Now, this next study here looked at rats and looked at neuropathic pain. And they evaluated full spectrum CBD extract, and they also evaluated CBD isolate and THC isolate. And what they found was that the CBD rich extract with multiple cannabinoids actually provided better pain relief than either the CBD isolate or the THC isolate. So in terms of dosing, a lot of people have questions about dosing, and we want to make it clear that, you don't want to say, well, if it works in humans like this, then, it's going to work in animals like this, right? Because, the physiology of animals is going to be different than the physiology of humans. And so one of the things that is very similar is that the peak plasma concentration after administration of cannabis orally in both dogs and cats is about 1 to 2 hours. And that's similar to what we find in humans as well. That's when the maximum concentration in the bloodstream is. Now, that's not to say that it won't take effect before that. Certainly, a lot of times, 30 minutes in, we'll feel something, the animals can feel something as well. But the peak plasma concentration is about 1 to 2 hours after administration. Now, in terms of the exact dosing, this is actually variable. And it's based on the condition that we're looking at and also the individual patient. So what some of the studies have shown out there is that in dogs and cats, that there's different absorption rates. So, you may give the same amount of, say, CBD to, two dogs that are the same weight, and one may absorb much more than the other. And so what we always do is we always start at a lower level, and then we gradually increase that dose to be able to find out the optimal dose for that patient. Because what we want to do is we want to find the lowest dose that provides the maximum benefits, because we don't want to use less and then leave any benefits on the table. And then we don't want to use way too much and then be essentially wasting product when we could be able to use a lower amount. So that's why we always start low, and then we gradually titrate up to the optimal effects, because the dosing is variable based on the condition and based on the individual. So you may not treat a patient that has epilepsy with seizures the same as you might treat a patient that has anxiety. So start low and then gradually move your way up. Now, the formulation is actually something that's really important. Just as I touched on before, the difference in between full spectrum extracts versus something that's a CBD isolate. So when we look at a product, we want to know what its cannabinoid profile is like. Not just the presence of major cannabinoids that we find like THC and CBD, but we also want to know if it has minor cannabinoids as well. Does it have CBC, CBG, CBN? Because this represents a full spectrum. So, if it just has CBD, it may not be as effective as something that has THC, CBD, CBC, and CBG. Another thing that's really important when it comes to dosing is the cannabinoid ratio. So for us, we have two different ratios. We have a 20-to-1 CBD to THC product, and then we have a 10-to-1 CBD to THC product. The reason why this is important is because some patients may actually benefit from lower ratios. So for example, for our products, we recommend patients start off with the 20-to-1 ratio. Now, if they think that there could be more benefits, if there's, for example, severe pain, severe appetite loss, then we may have them go to the 10-to-1 ratio that has slightly more THC, and then again, starting low and then gradually titrating up to effect. So the cannabinoid ratio is something that's important to look out for. And again, like I said, start low and then titrate up to effect. Same thing with people. When you're a person, you don't start at a really high level and just say, okay, maybe I should just back it down, right? Start low and then gradually titrate up to the optimal effect. So one of the really important things about cannabis products or cannabinoid products in general is lab testing. Now, in the regulated licensed California market, lab testing is required through, for every single batch of product that gets produced. For us, what we do is we go an extra step. We do a triple testing procedure. So what that means is that we will test at 3 phases throughout the product cycle. So when we have the individual ingredients, when we have the cannabis extract, we will test that for cannabinoid profile, for pesticides, solvents, microbials, mycotoxins, and heavy metals, because we want to know that we're only dealing with high quality, safe material. Even our organic extra virgin olive oil, we will test that as well. We will test that for heavy metals, pesticides, solvents, microbials, mycotoxins, because we want to know that all the ingredients that we're utilizing are safe. During the manufacturing process, what we'll do is we'll do a potency check. So we want to make sure that whatever's been produced is actually what's going to be matching on the label. So if it says 20-to-1, 125 milligrams of CBD, then we want to know that that's exactly what's going to be in the product. Once the product is finalized, once it's batched and boxed up, then what we'll do is the lab will come down and the lab will sample the product randomly, pull a bunch of sample units, and then go test it at the lab again for potency to check the cannabinoid profile, pesticides, solvents, microbials like E. coli and salmonella, and the mycotoxins, and then heavy metals. So this is our triple testing procedure to make sure that we're dealing with only safe, clean materials, and then at the end, we're getting safe, clean, consistent product. So some of the caveats that I always like to share with people, because people want to know, I've heard that cannabis can be used for anything and everything under the sun. Well, that's not true. That's not the case. It is not a panacea. So we want to make sure that people are well aware of that. Now, cannabis does have a lot of therapeutic benefits, and it can be used for a lot of different things. And that's one of the most amazing things about it, is that we really don't have any other tools in our arsenal that are as versatile as cannabis. For example, when a patient walks in and they're an epileptic patient with seizures, we're not going to prescribe the same anti-seizure drug for a patient that walks in and says, oh, I've got terrible nausea and I need something to stimulate my appetite. So that's one of the most amazing things about cannabis is how versatile it is and how many different things it can treat. Now, having said that, it's not a panacea. It doesn't treat anything and everything out there. So that's something that's really important to understand. And so that's why I came up with that acronym PAINS, is to help people understand these are the primary things that we know that cannabis is very, very good for: pain, anxiety, inflammation, nausea, seizures. Now, there are more uses that we're finding out about cannabis, in particular, as we look at some of these other minor cannabinoids like CBC and CBG and CBN. So, that's not to say that that's the only things it can be used for, but those are the primary things that we know it works really well for right now. So one of the things that we talk about is, use caution when it comes to cardiovascular compromised patients. So what that means is that patients that have any sort of heart issues, that have heart disease, we want to be very careful in those patients, because some cannabinoids, like THC in particular, can alter cardiovascular parameters. So what that means is it can change the heart rate or it can change the blood pressure. It can either increase or decrease the heart rate or the blood pressure. Now that tends to happen when, high amounts of cannabinoids are used. We tend to use very, very low amounts of THC, but regardless, we do want to be cautious in patients that have any heart issues. And so that's why it's so important that, if you're considering using cannabinoids for your pet, to talk to your veterinarian first, because your veterinarian is the one that knows your pet best and knows medical history, and knows the other medications that your pet's on, and they are going to be your primary source of medical information for your pet. So before starting on any sort of cannabinoid therapeutics, always talk to your veterinarian first. Now, potential drug interactions, this has made some headlines over the past couple of years because CBD is what's called a competitive inhibitor of cytochrome P450. That's a fancy name for a liver enzyme out there that metabolizes a lot of medications. And so what that means is that when a patient is taking CBD while they're taking another medication, there is the possibility that that other medication may not be metabolized at the same rate as it normally would. So potentially what that means is that you can have elevated levels of that other medication if it's being metabolized through the cytochrome P450 pathway. And so that's another reason why it's really, really important that, if you're considering cannabinoid therapeutics, to always talk to your veterinarian first, especially if your pet is already on other medications. So I want to talk a little bit about AB 2215 and why it's so important. So AB 2215 is a law that went into effect January 1st of 2019. When I started the company in 2015, I would always tell people, talk to your veterinarians, make sure your veterinarian's in the loop. And a lot of feedback that I got was my veterinarian feels they're afraid, they can't talk to me about it, that they're concerned about, the legal aspects of it. But since January 1st of 2019, your veterinarian is protected. They are allowed to discuss cannabis with you. Now, it doesn't allow for prescription, but they can at least discuss cannabis with you. So if your vet, says they're concerned, that, they're hesitant about it, let them know about AB 2215 so that they can read about it and they can understand that they are allowed to discuss cannabis with you. So a little bit about us. We are veterinary formulated. I do formulate all the products. We do have veterinary nurse support on staff. So if you have any questions, if your veterinarian has any questions, you guys can always email us. You can call us, and we do have veterinary nurses that will help you in however we can. And if you want to talk to me, I'm more than happy to do so. I talk to people all the time, because people have a lot of questions about cannabis and how it can be used. I talk to a lot of veterinarians as well because, one of the most important things that we do is educate. We do use full spectrum extracts. So the most important thing about the full spectrum extracts is the entourage effect that you get and the increased therapeutic benefits that you get compared to something like isolate. So that's why you want to make sure that whenever you're looking for a product out there, that you're using something that's full spectrum that gives you that improved therapeutic benefit versus something that's CBD isolate. We do lab tests. Like I mentioned, we do lab tests. We do a triple lab testing procedure where we initiate testing at 3 points throughout the production phase. And we are available at fine California dispensaries throughout the state, such as Bud and Bloom. Now, the suggested uses that patients use our product for is to support their joint mobility, to help support normal brain function, to help maintain normal GI health, and to help maintain calmness. All right. And if you guys want to follow us on social media, those are our social media handles. And then check out our website, vetcbd.com. And if you have any questions, you want to reach out to us, info@vetcbd.com, or you can give us a call, 562-754-3713. And that'll wrap it up for me.
That's great. Thank you so much. You actually answered a couple of questions that I was going to pose, like the dosing and the drug interactions, because that's what I get asked a lot. I had a couple interesting questions. Now, what should pet owners do if they feel like they maybe gave their pet a little bit too much, product? I know some seniors sometimes get a little scared and they might rush their dog to the pet hospital, but what would you suggest?
Yeah, if there's ever any concern, do check with your veterinarian. It's always better to be on the safe side of things, right? Because when I was working ER, we had people come in all the time, and sometimes people think, oh, maybe it was just a little edible that they got into or something like that. But I would always ask them, well, could there have been any other ingredients? Was it chocolate or anything like that? Because there's other things out there that are potentially toxic to animals, such as chocolate, grapes, raisins, xylitol. And so, those are all things that you want your veterinarian to be able to assess. And even if it's just a slight concern, it never hurts to talk to your veterinarian and to loop your veterinarian in. So that's the most important thing, is to be able to feel safe and comfortable just going to your veterinarian.
Yeah. Thank you. Also, I had a question. You mentioned a couple different animals that you treated, but what is the most unusual pet you've ever seen use cannabis or CBD?
I mean, I wouldn't say most unusual, but I mean, it's just, we have had people use it for their birds. And that's something that is really, really cool, because birds have some really unique physiology. First they got wings, right? They can fly. That in itself is pretty different. And we have seen it be used for birds for anxiety and arthritis purposes. And, in practice, treating birds was very, very different because their physiology was so different. So it's really great to see animals like birds be able to benefit from cannabis.
Definitely. And what is the best way to administer cannabis or CBD to your pets? Would it be orally, or I've heard some people put it on the inside of their ears. Does that even work?
Oral is the best way that we know to be able to get it into their system. Now, whether or not it works topically, it may. We don't know the extent, because some of the things that will factor into that is, how thick is the skin. But one of the cool things that we've seen is that we have had some pet owners apply it through the skin in smaller animals. So for example, we've had some pet owners use it for their rabbits, guinea pigs, and rats. And what they did was they just applied a small amount onto the skin, and it seemed to absorb enough systemically so that it could benefit them, because people were using it for example, like pain and arthritis in rabbits, and they were able to apply it topically and they got systemic absorption. And we actually saw one pet owner who was not able to give anything orally to her cat. Her cat had kidney failure and was not eating, had severe appetite loss, and she actually used our product topically and applied it onto the skin. And enough of it absorbed through the skin that the cat actually started eating again. But the best way for us to recommend the owner do is to give it orally, because we know exactly how much you're getting, and so you can be consistent about that.
Let's see here. Somebody's asking, is this something that you can use once, or do they need a buildup in their system? For example, like the 4th of July and fireworks, if the person gave it to their dog before they started, would it work? Did they need to use it like on a regular basis?
Yeah, so it can be used on an individual basis. It's not something that needs to be used every single day. And so we do have a lot of people that will use it for individual situations and scenarios. So for example, patients that may have social anxiety or that may have noise anxiety, we do have a lot of pet owners that just use it for those occasions. For example, car rides, they may just use it for those car rides. What I do recommend is that the pet owner figure out what the optimal dose is. So for example, like with the 4th of July fireworks, you don't want to just start trying to establish the best dose on July 4th. right? So you want to be able to figure out what the best dose is at least a couple days beforehand, so that way on July 4th, you know the optimal dose for your pet.
Yeah, definitely. You don't want to have them experiencing CBD or cannabis for the first time, and then on top of that, have the fireworks. That might be a little bit much for the pet. So that's really good information. Well, thank you everybody for your questions today, for being with us. Thank you, Dr. Shu, for creating such an amazing product and, dedicating your life to animals and to their well-being. I know that after this, I'm going to be a better pet parent myself and also a better consumer, because a lot of this information, relates to pets and to people as well. So thank you again. And I definitely suggest that everybody check out their website and contact the doctor if you guys have any questions. Thank you very much for being with us today.
Thanks for having me. I really appreciate it. Thanks, everyone.
Bye.
Bye.